right. Hi, guys. I'm going to go ahead and get started. We still have quite a few people that are in the process of joining. We can see that. So I'll kind of talk through a little bit and save the meat of the presentation for a couple of minutes, let everybody get in here. Thank you guys for joining us. It's a wonderful night, and it's kind of a sad night for us because our annual launch event is something that we always look forward to. And, a year ago right now, many of you guys were sitting with us classroom style in our Mind and Body studio, shoulder to shoulder, drinking wine, eating food, watching live demos, listening to my presentation. We banter back and forth and we laugh, and it is such a great night. So we miss that. And it's hard for you guys too, I'm sure, to believe that it was a year ago and so much has changed. But a lot of great things have happened for us. We weathered the storm of growing a second location in the middle of a pandemic. And that was the hardest thing we've ever faced and probably one of the scariest things we've ever faced, but we've done it. I'm here at Hamilton Mill. So for those of you, there's a lot of people that don't know us. So we do have a Snellville location and we have a Hamilton Mill location. So we are serving you on Brazelton Highway and on Jammer Road, just off of Scenic Highway in Snellville. So I'm gonna go ahead and get started. We still have quite a few people coming in, but I don't wanna hold you guys up too long. So I have some notes I'll be referencing all night, and no glasses because they reflect. So I might need some grace on that. Welcome to our annual launch. We have named this launch New Places and New Faces because not only are we now here in Hamilton Mill meeting all kinds of new people, our Snellville location is growing and thriving. And it's really exciting to see that area staying strong with young families moving in and coming in to visit the practice. We've been really excited to meet so many new people. Had the same great quality and great service. A lot of our staff members are actually working in both locations. So if you're used to seeing somebody in the Snellville location, you might actually see them here. Mary, Tara, and myself, the three nurse injectors, are actually working in both locations, so you can see us. Some of the estheticians are going back and forth, and a lot of the front desk staff are working back and forth at this time. I want to mention that our other nurse injector, Tara, is online tonight. So if you have questions, I really can't see with the setup that we have here, but if you have questions, she's going to be happy to help you answer those. And Sam is going to be posting some links for you throughout. The things that I talk about, he'll be posting links so you can go and take a look at those. And if you have questions that we don't get to right away, we'll be sure we answer those after the webinar is over. I probably won't be able to see if you're asking me a question directly, so I'm sorry. I'll get back to that later if it's for me specifically. We are actually, because we miss events so much, we all do. There were 200 people signed up for this webinar tonight, which tells us people are so thirsty to have something fun to do right now. We have actually started our girls' night out parties again. I guess it could be guys' night out. We haven't ever done that, but we could do that. For girls' night out parties, what we do is let you select about 8 to 10 of your friends. We'd like to keep it in that size range. If you guys are hanging out, if they're in your bubble and you're hanging out at home and you want to have a fairly close party here, that is fine with us. We'll do whatever you need to do. If you are not commingling and we need to be more careful with the COVID guidelines, we're going to adhere to that as well. COVID-friendly food and drinks. We supply the wine and beverages, and we supply the snacks and the goodie bags. We can make it as formal as you want or as informal. If you want to just gather your friends around the table and say, okay, what's the deal with this, whatever, lip filler or whatever you want to talk about, I can give you my knowledge. We'll have some other staff members here to share their knowledge on what we know about it and what we know that's good and bad about it. If you're 20, your party will be scheduled a little differently than if you're in your 60s. We might talk about different products and procedures that fit that group of people, or we can do a combination, that's fine. But those are a lot of fun. So if you're interested in that, just give us a call or a text or leave a message here and we can find a date for you. We have, we're booked up now until March, but we would be happy to start working to get you guys in. And I want to give you a quick history because there's a lot of you guys that I didn't recognize your names whenever you registered for the webinar. And so you may not have any idea who Chrissy Thomas or About Face Skincare are. So I am Chrissy. I started the business 19 years ago. So I was a plastic surgery nurse. I worked with the husband and wife team, Dr. Lieb and Dr. B.A. Peel. We had a practice over in the North Lake part of Atlanta, and I was their nurse. So I did the pre-op, I did the monitored sedation and surgery, and then I did the recovery. And they went to the hospital part of the time. So I started practicing skincare and learning skincare, doing chemical peels in the office, filling my time while they were in the hospital. I was used to working in the busy operating room at Eggleston. So this was a lot of extra time for me. And I thrived. I loved it. I'd always had acne and a horrible complexion, and I was able to learn some things that I could do to help that. And so as the years went by, they decided they wanted to retire while I was pregnant with our second child. And so we retired the practice on Wednesday. I delivered Ella, our baby girl, on Saturday. And 3 weeks later, I took my first About Face skincare client. So it's been quite a 19-year-long ride this March. Sam and I would put the babies to bed. We had a 17-month-old newborn. We put the babies to bed, and then we'd go in the bonus room. We'd work About Face until about 2 a.m. And it was absolutely exhausting and some great, great memories. Started hiring some staff members in. And in 2010, it was just too much for me to handle alone. So Sam quit the corporate world and he joined me here. And so now we have a staff of about 18 people, I believe. We have 3 nurse injectors, a staff of awesome estheticians, and a whole front desk administrative staff that is just lovely. And now the 2 locations to serve you. So if we haven't met you yet, we look forward to meeting you. We hope you'll come and see us soon. We're going to talk about several things tonight in our launch event. And we call it the annual launch event. It just sort of transitioned into this. I would start looking at procedures and treatments and products throughout the year that I thought we had a need for. And I never like to pick things that are brand new on the market, because I'll just like for everybody else to work out the quirks. And then we have a great product or a great service here that we can tell you all about based on watching everyone else's experiences. So normally things have been out for a couple of years and we've been watching them, and we do our research, we get products or services in, we test them out here to make sure it's something that's a good fit for us. And then we choose this time of year to bring things out to you and tell you all about it and let you take advantage of some discounted pricing as we launch it. I also want to mention that we have a calendar of events coming out. So, if you are looking for some things to do, we're going to have some things for you. We're having our ribbon cutting to celebrate our Hamilton Mill opening coming up later in March. We'll let you guys know. We're going to have a COVID-friendly reception here so that if you want to stop in and grab a prepackaged box of food, or just come out and celebrate with us, we would absolutely love that. We're so thankful to be in this community and be so warmly welcomed here. And of course, we love Snellville. That's where we grew up, Sam and me, and raised our family, and we still live there. So Snellville's always going to be very special to us. But please plan to join us if you can. We're also going to be having our spring sale. That's going to start March 1st. So we're going to tell you about the launch. We're going to tell you about the special launch pricing. It's going to be on our website. And then that launch pricing is going to go through the 28th of February. And on March 1st, we start our spring sale where everything's 15% off. There may be a couple of exceptions, but everything's 15% off generally. The launch pricing will end, and that will be the 15% off sale. So the launch pricing is better. If you want to get in on any of the things I'm going to talk about, you want to take advantage before March 1st. Let's see. And I also want to mention, we usually charge a little fee to get into the launch event and some of the other events that we have here at About Face. And we don't keep that money. We have an oncology aesthetics program called Sidestep Oncology Aesthetics. And we like to contribute to that fund through the fees that we raise from these events so that we don't have to charge our oncology patients for their facials. So we're not contributing to that fund right now because we're not having any events, but we do have a budget in there that has not been used. So if you know anybody that's going through cancer treatment right now and would like a little facial, we actually have 3 certified estheticians to serve. So we have Sherry Dursey, Latrinda Wilson, and Raquel Lopez that would be more than happy to take care of your friends and family that are going through cancer treatment right now. I do want to back up because I had a couple of pictures. This is just a picture from our girls' night out, some of the spread that we put out for girls' night out. And this is our Hamilton Mill location. I am sitting right here at the bar looking out the side window. So it is beautiful. You'll have to come and take a look. As warm and cozy and just feel like curling up with a blanket. We are in Snellville. This is bright and white and airy. So it's a nice change. It's beautiful. We love it. All right, let me get back. So the first thing I want to talk about tonight is something called TRX33. It took us a minute to remember that. It'll probably take you a minute to get that cinched in your brain. We've been calling it the P90X because we couldn't keep it straight. This was developed by an Italian company. This is a very interesting product. I have a lot of people that come in. We see people every day that say, don't you think I need a chemical peel? I think I need a chemical peel. And then when we start talking about chemical peels and downtime and all the things that they're going to have to go through with that, they're like, oh, I don't think I want all that. So the good thing about this PRX-T33 is it is based with trichloroacetic acid. Now, TCA, as we call it, is a very famous peeling agent that we've used for years and years in this industry. But you have to be very careful because you have to pick a certain skin type, and you're going to have some major discomfort with the peel, and you're going to have some downtime with massive, massive amounts of peeling. So what this company did is they figured out a way to buffer this TCA, 33% TCA, with hydrogen peroxide. And so whenever you mix that hydrogen peroxide in with this PRX-T33, with the TCA, the peroxide will buffer it so that the TCA does not affect the outer layer of skin. It's not going to break down the epidermal layer, but it's actually going to sink down into the skin and give you all the benefits of a peeled skin that's been treated with trichloroacetic acid with no downtime. Now, I want to pause and say it is known as the peel that doesn't peel, but you can peel a little bit. Now, you're not going to peel in sheets. Typically, we won't see that. But if you need to exfoliate or if you're a little bit sensitive, sometimes you will get some flaking. So I don't want to misrepresent that. It doesn't hurt. And I will say as a side note, on a scale of 1 to 10, we hear 2, 3, maybe a little bit peppery and stingy, like if you're using a glycolic acid, but we really don't hear complaints of discomfort with this. So it is just a lovely treatment. We put it on as if we're doing a facial, because you have to apply the peel with about 3 pounds of pressure to get that peel to penetrate down into that lower skin level. So it feels great. It feels like you're getting a facial. You feel a little peppery, maybe a little tingly. It's really not that bad. And then we neutralize it with water. It's actually a self-neutralizing peel, but we do go ahead and we rinse off that peel. Now we can treat the face. If you buy this treatment, we are going to be treating the face and the neck unless we talk otherwise. So we can treat the eyelids. We can treat the lips, the nose, the neck, all these thin areas. So we do treat that entire area. We rinse it off. We put a really nice velvety cream that comes with the peel on the surface of your skin, and you're ready to go. You can put makeup on. Your skin's going to be dewy and nice. Sometimes people get a little bit pink, but that is not typical. It doesn't last long. And you're ready to go. You should continue to get better from there. Sometimes people have a little bit of dry patchiness for a couple of days. It's really nothing major, and putting on that moisturizing cream really makes that better. We sell these in a series of 4. Now, if you're just wanting to freshen up and brighten up, you can do one and it's going to look nice. But the studies are designed around the premise that you're going to do this series of 4. So you're going to come in 1 time a week to do a peel. It takes about 15 minutes. It's a real fast, easy treatment. So we would see you 1, 2, 3, 4 times, and then you're good to go for 6 months. So we would talk about your maintenance. Some people like to come in every 6 months and do that series of 4. Some people like to do the series of 4, get the glow, and then come back every month. You can come back every month, every couple of months, once a quarter to do a single peel. As long as you're keeping that glow and you're satisfied, we're satisfied. But it is sold to be done in a series of 4. Now you can also treat body parts with this peel, not a peel, excuse me. And so in doing body parts, we're probably going to do more than 4 treatments, but it is wonderful for treating this elbow skin. that hangs a little bit. It's awesome for the skin above the knee. I've talked to a lot of you about like your arms or like the top of the arm here where it's starting to get just kind of crinkly. It is a good option for that. And in pricing, if that's something you're interested in, I want us to talk with you. I want either myself or one of the staff members to talk to you to get a price together, because it might not be that standard pricing that we're talking about tonight, but we'd be happy to sit down and go through that with you. Whenever you buy the series, we do send home that cream, and we also send home an exfoliation agent. So in this 4 weeks that you're doing this peel, you're gonna, at night, you're gonna wash your face. You're going to use this exfoliating solution that we're going to send home with you, and you just put it over your face. It's a real light acidic solution, but it's also going to help continuing to exfoliate that surface of the skin. You'll wait a few minutes, and then you put your cream on that we're also sending home. If you wanted to continue to use your vitamin C serum, we want you to continue to use your sunscreen, your usual cleanser. The only things that we ask you not to use are retinols and glycolic acids while you're going through this program. But this treatment is so exciting. I have watched it. I've talked to some of my peers that have brought it in other parts of the state. They can't say enough for how much it treats fine lines, wrinkles, dull skin, pores, tightens pores, gives you an overall lifting. I don't want to oversell that, because if you're looking for really nice lifting, we would talk about Vivace and some of the other awesome treatments that we have. But just for an overall glow and tightening, you can't beat this TRX33. It is awesome. So if you have any questions that I didn't cover, you can go ahead and type those in, and Tara can help you. Or if Tara doesn't get to the question, we will get to it after the presentation. Next, I want to talk about a new system that we've gotten in. It's called the Diamond Glow Dermal Infusion System. Now, this is an awesome, awesome system. We know that if you want to get your skin in better health, we need to exfoliate the surface of the skin. Before you start using products, before you start doing anything, we want to get the surface of the skin in good shape. We can do that with chemical peels. We used to do that with microdermabrasion, and that is a little bit antiquated. We really don't do microdermabrasion as much anymore. We have the hydrofacial system. We love hydrofacial. And hydrofacial is a more chemical exfoliation. So it's going to work more on the surface of the skin. It's going to exfoliate with a chemical peel and that little vortex tip and infuse the surface of the skin with some serums. If you wanted to kick it up a notch, we would talk about the Diamond Glow system. And I want to pause to say this is only available in Hamilton Mill for right now. Sam has promised me that we are soon going to buy a machine for the Snellville location, and I might need all my sisters to gather in and convince him that we need to go ahead and get that next week. But we are planning to get a system in Snellville very soon. It is worth the drive, though. I promise you, it's worth the drive to Hamilton Mill if you want to do the Diamond Glow. So with Diamond Glow, we are actually using these little diamond encrusted tips, and they have a little suction in it as well. So we're able to mechanically use these diamond encrusted tips to go across the surface of the skin. Let me see here. I'll just show you what that looks like. We're going across the surface of the skin. So it's actually doing deeper extractions and more exfoliation than our other devices here. And after we do this exfoliation, SkinMedica has developed these 5 different serums that we're able to combine to infuse into the skin while the skin is nice and open. So there's one for brightening, one for dark spots. I think there's a really intense moisturizing serum, and the estheticians are able to pair whatever they think you need. And while your skin is just sitting open, exfoliated and ready, they can infuse those serums and really make some changes in the skin. So this is the type of thing that you can come in and get one treatment, look great. If you want to be a little bit more aggressive with your skin and make some real changes, you can buy a series of these treatments, and we'll structure how often we want you to come in and do those and start seeing some nice changes. My number one favorite part of this is that it is owned by Allergan. So those of you that have ever done Botox, Juvederm, bought SkinMedica products, bought Latisse, bought Cool Sculpting or Cool Tone, you know they have that awesome loyalty program. It used to be called Brilliant Distinctions, and now it's called Ally. They just migrated that into a new system. But you earn points on all these things, and Diamond Glow falls in that whole category. So you come in and you buy your Diamond Glow, you're earning money for your Botox. Or you come in and you get your Botox and your filler and your cool sculpting, and your Diamond Glow might very well be free. So it's an awesome collection of goods in this portfolio. There's some other very exciting things happening with that Ally program, and we will be back. It's too much information for tonight. We'll be back to tell you about that, but you guys stay tuned whenever you hear that, because you're not going to leave what they're doing, actually encompassing all of our products and services. So we're going to get back to that. So that is our presentation on the Diamond Glow infusion system. So if you have any questions, there again, just type them in for me. Tara will get to them if she can, and if she doesn't get to them, then we're going to answer those afterwards. Next, I'm really excited about this one. We're going to talk about chin augmentation. So in my career, the idea of doing injectable fillers has changed so very much. When I trained years and years ago, I was trained to do lips and to do parentheses and maybe put a little down here if you're seeing the marionette lines. And that was basically it. And then we got fancy and we started putting a little bit in the cheek front, and we put a little bit in the tear troughs, and we rocked on with that for years and years. And then all the people that study these things got really smart, and they started letting us go to courses that taught us about facial symmetry and restoring volume loss with filler. So we've talked about that before. I won't get into all that tonight, but we've talked about restoring, I think I kind of need that actually, restoring the mid-face by putting a little voluma here, restoring the jawline by putting a little bit of voluma here. And now it just makes perfect sense that we've done the entire face, and it's time to think about the chin. So it happens at least twice a month that somebody's going to come in and say, I think I need to talk to you about cool sculpting or Kybella here. I have a double chin and I don't like it. Or I hear my nose, I think my nose is too big. I think my lips are too small. They really don't know what they're seeing, but their brain is seeing something disproportionate about the face. Now, if somebody likes their chin being a little bit smaller, we are all for that. We are not in the business of making faces look different unless somebody comes to us and says, I don't like this about myself and I'd like some help with making this look different. I want that to be known. We are not in the business of making you look different. If you're happy, we love you the way you are. If you want our help to make a little bit of change, we can do that for you too. I want to show you this lovely lady. So she came in to see me and we had that conversation, she just kind of wanted to fix something. And we were talking about how the forehead is smooth and beautiful. She's a young woman. Everything looks wonderful. Mid-face is smooth and beautiful. And her chin was just a little bit tucked. And so we talked about what we could do to help her with that. And so you can see on here that her chin looks a little tight. Her muscle was actually very tight. So we gave her a little bit of Botox here in the chin. And then we gave her an injection of Voluma around the chin line here. And you can actually see between the two that she looks a little bit more balanced. Her chin now matches a little better with the proportions of the upper face. And she was thrilled. I talked to her, touch base this morning just to make sure she was okay with these pictures tonight. This is sort of an oblique angle, and you can see how we lengthened her chin downward. If sometimes people need a little more length on the chin, sometimes they need a little bit more projection. So we're able to look at a chin and decide, does it need to come out this way? Or does it need to come down this way? Or maybe a little bit of both, just to give that continuity of the jawline. This is a client that gave me permission to use her photos. We actually only did her 5 days ago. So this is a very, very new result. It takes about 4 weeks to see Voluma open up and do its thing. So this beautiful woman came in and we did a little bit in her lips, and I got a call from her a couple of weeks ago, and she said, I want to come in and talk about my chin. I think I need Kybella because I've always had this double chin. So I knew, just because whenever I took her initial pictures, that she had a chin that was a little bit shorter. And so we talked about it. And she said, well, I see exactly what you're talking about. We wouldn't want to take fat here. You can do a little cool sculpting or a little Kybella there, and it actually is going to make the chin look longer. That's why we do it. But to build the chin out a little bit is actually a better result overall. Now, we have done a little bit. That's another thing that we do a little bit differently than some practices do, and some might be even a little more conservative than we are. But you will look at photographs of this online, and sometimes it looks like the chin is very bold, and that's not really our style. Although if that's what you want, we are happy to do that for you. But we've given this young woman a more conservative fix. We might actually go back and inject a little bit more in 4 weeks, but we don't want her to feel like her chin is entering the room before she does, especially when she's not used to having that definition in the chin. So you see the difference. This is when she first started with us. And this other picture is from Monday. It was 5 days after injection. So this chin was injected with a little bit of Botox, which means it's going to relax down even a little bit more over the next couple of weeks. And then we did an injection of the Voluma in this area. We gave her some length on her chin. She didn't need her chin to come outward. She needed it to lengthen a little bit. So let me show you her profile view. And you see where she thought she had the double chin here on the left. Whenever you add a little bit of length on her jawline, she actually has less of a fullness under here. Now, as I said, I did a little Botox, so her chin is still a little bit tight. That's going to actually relax down. And we may even add a little bit more material at the 4-week mark. So for you guys watching tonight, she doesn't mind. I'll post her photographs on Facebook for you, and you can see where she ended as opposed to where she is right now. This is a very fresh result, but it's a wonderful result. You can see that she just looks a little bit more balanced, and she looks like she's a little bit leaner under here. She is thrilled with the results so far. So we will keep you posted. This product will last about 2 years. Voluma notoriously lasts 18 months to 2 years, especially in the chin area, because we're using a little bit more in a confined space. When we use it in cheeks, sometimes we'll see it last 18 months or so, and it's only because the product wears down and gets a little bit smaller, so it's not full enough to do that lifting that it used to do. I actually did put a little bit of the Voluma in this woman's cheek right here, because that was coming down across her mouth, and just lifting that up with just a little bit across her cheekbone here gave her that little bit of light bounce, and it also pulled some of the weight from the chin, so that then when we projected the chin, it looked a little bit better. So yeah, very excited about these results. And if you're feeling like that's something that you might need, or you're just not sure, you think you might want to do a little something with the symmetry of the face, just come and talk with one of the nurse injectors. We'd be happy to go through that and take a look at it for you. So I'm going to move on now to my next goodie for you. And that is get my little graphic up here. It is our new retinol serum. I am so excited. Isn't that the most beautiful packaging? This is from our 180 line. So this is not for just anybody to come in and buy. I want you to listen to me on this one. There are 3 ways to stimulate collagen in the skin. And I've talked about this in previous webinars, so a lot of you have already heard this, but you can use growth factor, which we have in our TNS serums. Those are wonderful. You can use peptides, and that is wonderful. Revisions makes DEJ Face, and I love DEJ Face because I have rosacea and extremely sensitive skin, so I can't use retinol. Everybody else seems like can use retinol, but not me and a few of my little friends here. So if you have very sensitive skin, this isn't something that I want you to buy. I want you to talk to us because we have other awesome things for you. This product is for the million of you that have been in the past few years, and you use our retinol products that we already have, which would be Retinol Complete by Revisions and the Retinol Serum by Skin Medica. And there's also Crinkle Cream in our 180 line. And those are all products that contain 0.05% retin A and maybe some other ingredients in there. I'm sorry, I'm talking too much. So this product came to us. I noticed it because it was actually mentioned in the Dermatology Drug Journal as outperforming generic tretinoin. Now that's big news because that is a prescription retin A. And this product actually outperformed that product in study. So it got my attention. I called the rep and I talked with her, and I was really excited once I heard all about it because it has all these awesome ingredients in it. So this is actually like a 0.1% retin-A. Everything else in our practice is a 0.05%. So this product is for you if either you have tough skin that's not sensitive, or you've been using our 0.05% retinol preparations and you're ready to kick it up a notch. So the other goodies that are in this, it has 5 ingredients I want to tell you about. It has an all-trans retinol, which is a pure form of vitamin A. And that's the part of it that's going to treat the fine lines and the wrinkles and the texture and the pores and all of the good things that retin A does. The second ingredient is something that we've talked about before. It's actually in the Retinol Complete by Revisions, and it's called bakuchiol, Bakuichol. And bakuchiol is actually a botanical found in nature. They take the seeds and they grind up the seeds, and these seeds actually, when they are applied to the skin, it will act like a retinol and it will act like an antioxidant. So it acts like a retinol in stimulating collagen and creating this smoother surface, but the antioxidant part of bakuchiol is calming everything in the meantime. So it has the bakuchiol in it, which is a great ingredient. It also has green tea polyphenol, which is notoriously in our 180 products. Green tea polyphenol is like drinking 500 cups of green tea. It is the pure form of green tea, and it's a very calming, very protective antioxidant. So by nature of that being in there, it's going to be very calming. It has licorice root extract, which is a notorious skin brightener, but very safe. It's very natural. So it's not one of the chemical ones that we worry about with people. Most everybody can use that product, that ingredient. And then the last ingredient is so neat is caffeine. So when you put caffeine into a product, it's going to accelerate the action of the ingredients and make them penetrate a little better, but it's also going to decrease the redness that sometimes you see with retinols. So this has been so popular and is flying off the shelf with a few people that are coming in and seeing it in the past week. So I think you guys are really going to love this. I want to give you a couple of words about retinols, retin A in general. It does not like water. And so 9 times out of 10, when somebody can't use retin A, it's because they're washing their face and they have that misconception that I got to get things on while it's wet so that it penetrates better. That is not the case with retinol. It's going to get angry with you and your skin is going to revolt and get red and peely and inflamed and be very uncomfortable. So you want to make sure that you wash your face and then brush your teeth, pick out your clothes for tomorrow, take your time, about 15 minutes later, come back. This comes in a little dropper. So this one isn't a dropper. Some of the other ones are cream based, but you're just going to take the dropper of this, put a few drops in your hand. You want to just apply it to the 5 points of the face and then just kind of rub it in from there. Put a little bit on the neck. It can make the neck dry, so watch that. You might want to start any retinol product, including this one, like every other night and work your way into every night. If you start getting the redness and the dryness, just back off for a couple of days, nourish the skin with your moisturizers, and then you can carry on. You would apply this first on the skin in the evening, and then you could apply your moisturizers on top of that. And as I said, with the TRX33 Peel, you do not want to use retinols for a week before you start the peel. So I would say don't use it through the peel series because you really aren't going to have enough time. Stop it the week before you start the peels, do the peels once a week, wait a week, and then start back on your retinol. Okay, so that is our new baby, the Retinol Plus. We're excited about that. So I did not mention that we are giving away about $2,000 in prizes tonight. Susie's here with me in the other room. So she has gone through our list